So what we're going to do today is something which is a big trend in modern aesthetic medicine, and is the whole face approach to rejuvenation of the face and anti-aging. The main thing is that what we're going to try and do is by using mainly dermal fillers and with the help of Botox, we'll try to restore in every patient in modern day the lost volume. Because one of the main ways we age is by losing volume. We lose volume in our cheeks, we lose volume around the jawline, we lose volume around the temples. So we suddenly develop eye bags because of this, we develop nasolabial lines, jowling, everything starts drooping around here. And by replacing that volume with fillers and tightening wrinkles and lifting eyebrows with Botox, we can get an amazing result. But also, it's very important to mention, even though 12 syringes over 3 visits sounds like a lot of syringes, but actually you can put 12 syringes in a soup spoon.
I'm afraid a little bit of Botox.
Botox is very, very safe because it's called botulinum toxinum. People sometimes say it's a poison, it's a toxin. It's not, it's a purified protein. We actually use Botox in so many branches of medicine, it's safe. From that point of view, rest assured it's safe. What's important is it's the same fillers we used to use, like Restylane and Juvederm, but we now understand better how to use them. And we usually now place lots of small doses, mainly laterally, and we make a lift of the face. So we're now 4 weeks after the first treatment. We're doing the whole face approach on our patient, where we're going to do between 8 and 12 syringes to rejuvenate and do the facelifting. About a month ago, we did the upper face, we did the cheeks, we did the eye hollows. Today, we're going to concentrate on the lower face, on the jowling, on the jawline. We're going to use again about 4 syringes of hyaluronic acid dermal filler. And I think we're going to get some really amazing results. In 4 weeks' time, the final touch, some more fillers. We might even straighten the nose or do something with Botox on the upper face. But today, we're concentrating on rejuvenation. So here we are after about 10 weeks since we first brought Layla along to do the whole face approach using dermal fillers. We've done 12 syringes of dermal filler over that time. Each time we did 4, and on the final session we did some baby Botox as well. So I spoke to her earlier on, and what her friends have said, they can't tell she's done something, they can tell she's done something. She's now the baby-faced person that she is in her personality. And when she first came, there was a tired look to her, as we remember. So that's been the very satisfying thing. And we've shown that 12 syringes of filler in a young person like her actually can give some very natural results. And we're very happy. What about you, Layla? What do you say?
I'm happy, of course. I look younger. I don't need so much makeup. And people notice that I look fresh and rested. But nobody could tell what exactly I did with my face.
But the best thing is that it's so natural. The change is really natural.
Great. So it's very natural. So the whole face approach, very happy patient, very happy doctor. Everybody's happy.